Complicated heart and brain surgeries are becoming a little less complicated at one New York hospital thanks to the help of a 3D printer. Heather Lai shows us the new medical tool that's helping save lives.
These piles of squiggly pieces and twisted tubes might not look like much, but they're changing the way doctors in Buffalo perform important, complicated surgeries.
When it comes to the human brain, there's no parallel in the known universe. It is a uniquely different organ, and with it, it has a uniquely different blood supply.
These custom 3D printed pieces represent parts of the human vascular system, and surgeons are using them to do trial runs before an actual procedure.
We can take the same anatomy that we'll find in a patient, 3D print it, and then perform these procedures, whether to test a new device, test a new strategy, or devise a treatment plan for a particular patient.
The so-called phantoms are lifelike models of patients' hearts and brains. Each one is unique and created using scans taken through 3D medical imaging.
Some of them can be actually made to simulate people with diabetes, and others we can simulate the mechanical properties of a healthy person.
It takes 30 minutes to 24 hours to make a phantom, so they're not ideal for emergency procedures. This 3D printer has multiple cartridges and can combine materials at a droplet level. That allows for more flexibility, and engineers can replicate vessel geometry down to a 0.005 of an inch.
These models that we are making are mostly intended for very difficult cases.
The models are warmed up during surgical practice to simulate the gummy feeling of real arteries. A mixture of glycerol and water is pumped through to simulate blood flow, and sensors are hooked up to the models to measure blood pressure. Previously, doctors wouldn't know until an actual surgery whether their plan or device would work. Sometimes they have to change a surgical plan on the fly, but the longer they're working in a blood vessel, the higher the complication rate.
You are no longer going through that dichotomy of decision making. You have a very clear plan, and so it results in a smoother, faster, more effective, and eventually a safer procedure.
Right now, it's optional for insurance companies to cover these devices, but they're hoping it will become mandatory in the near future. Children are less likely to wear seatbelts when the driver in the car isn't buckled up. A new study of crashes involving passengers under the age of 20 shows kids were 16 times more likely to be unbuckled when the driver was too. This as the annual Click It or Ticket campaign kicks off this weekend to crack down on those not wearing seatbelts. The federal health officials want to make sure less food is thrown out because of confusing food labels. The FDA sent a letter to the food industry saying it supports efforts to standardize date labeling if the date is simply used for quality. That includes using a best if used by label, which is the date when the flavor or quality of the item may decrease, but it's still safe to be consumed. The USDA says roughly 133 billion pounds of food are thrown out every year, in part because of date label confusion.